Please proceed.
Good morning, Mr. Chair and members somewhere watching.
There
Thank
are
you for being
millions watching, you can rest assured.
many are watching. Thank you for being here today. I'm excited to begin the discussion regarding an important resource for our youth. SB 1368 would update the comprehensive sexual health and HIV prevention education required for students in 7th through 12th grade to include information about licensed pregnancy centers as part of the instruction on local resources for sexual health and pregnancy. The California Healthy Youth Act requires every school district to provide information about local resources, how to access local resources, and pupils' legal right to access local resources for sexual and reproductive health care, such as testing and medical care for HIV and other sexually transmitted infections, and pregnancy prevention and care. Information on licensed local pregnancy centers has not been presented to students in grades 7 through 12, despite the variety of services these centers offer. These centers serve women and couples facing unplanned pregnancy with empathetic reassurance and free services that may include medical services like pregnancy testing, ultrasound and STD testing, options counseling, community referrals, prenatal medical care, and practical aid. We have a looming primary care provider shortage in California. These centers are filling this gap where we need more reproductive health care providers, particularly in rural areas, low-income areas, and for people of color. The Federal Health Resources and Services Administration reports that more than 13.1 million Californian residents live in a primary care shortage area. Many women know where to go to get an abortion. You know, you can go to Planned Parenthood, but most women don't know that free resources from pregnancy centers exist. There are 166 Planned Parenthood locations, which are primarily in urban areas, and 98 licensed pregnancy centers in California. There certainly is room for all when it comes to reproductive health care. In fact, many pregnancy centers report that Planned Parenthood will refer women to pregnancy center cares if a woman refuses an abortion and wants to keep her baby. Young women in crisis bear the heavy weight of making life changes decisions, often in secret. Licensed pregnancy clinics allow women to talk about all their options with a medically licensed, sympathetic person in hopes that they may be able to make a decision with a clear conscience and have a full support system behind them along the way. I like to emphasize the bill will not replace current curriculum or remove existing resource information from instruction or the Department of Education's website. It simply brings into parity the resources offered to students, giving them information on both Planned Parenthood and licensed pregnancy centers, license keyword, because with diverse options, we create informed futures. But let's allow the statistics to speak for themselves. In 2019, pregnancy centers in California provided services and materials valued at more than $14.3 million, serving 93,957 women, men, youth, and families. There were 33,802, yes, two, free pregnancy tests, 22,264 free ultrasounds performed by registered nurses and medical sonographers, 4,571 total STD/STI tests performed by RNs, 77% female and 23% male. These medical services totaled 7,341,844, but were free of charge for our communities. The free material items have also made an impact, providing a total of 187,127 total free baby items to families in need. 56,100 packs of diapers, 31,931 packs of baby wipes, 97,176 new and used baby clothing outfits, 1,180 new car seats, and 740 new strollers. All of this is made possible by the amazing staff behind these centers, 2,579 of whom are completely volunteers. These centers are licensed by the California Department of Public Health. Additionally, some are also accredited by the Accreditation Association of Ambulatory Health Care, also known as AAAHC. AAAHC was founded more than 40 years ago to encourage and assist healthcare organizations to provide the highest achievable level of care for recipients by continuously adding new standards while updating existing standards to reflect cutting-edge ambulatory care, knowledge, and practice. AAAHC is one of the main nationwide accreditation organizations for U.S. healthcare facilities. Licensed pregnancy centers often have medical teams that consist of an OBGYN physician, a nurse practitioner, licensed registered nurses, and RDMS licensed sonographers. There is plenty of evidence that supports how resourceful these centers are in our disadvantaged communities. This is why we need to spread better awareness among them to our youth. Joining me today to testify on behalf of California Pregnancy Centers, we have Kathleen Jones, who is CEO of Life Choice Pregnancy Center in San Bernardino. We also have Kelly Bradford, who will speak on the perspective of a pregnancy center client.
Welcome to both of you. Please, 3 minutes each. Please proceed.
Thank you, Mr. Chairman and committee members. My name is Kathleen Jones, and I am the CEO for Life Choice Pregnancy Center, a state-licensed community medical clinic in San Bernardino. I'm also board secretary for the California Alliance of Pregnancy Care. I'm here in support of SB 1368 and grateful for Senator Ochoa Bo's heart and passion for educating the youth of California. Life Choice Pregnancy Center, as well as other pregnancy care centers affiliated with California Alliance of Pregnancy Care, are fully committed to educating, informing, and guiding students regarding human development, sexuality, pregnancy, contraception, and sexually transmitted diseases and infections. The 98 licensed pregnancy care clinics across our state are easily accessible and free to everyone in need of assistance and education. These centers and clinics provide pregnancy testing, ultrasounds, material resource assistance, including maternity clothes, baby clothes, accessories, diapers, wipes, food, formula, and this is just a small sampling of the material aid we provide at no cost to our clients, our community, and the state. California's pregnancy care centers and clinics provide information, education, and material assistance while delivering high-quality health care and support. All California students deserve a complete listing of the available community resources during their comprehensive sexual health and HIV prevention education, which should include pregnancy centers and clinics. I urge you to vote aye on SB 1368 to ensure that our middle and high school students are fully informed about all community resources available to help them make educated, informed decisions about their sexual health. Mr. Chairman and committee members, thank you in advance for your support and a yes vote on SB 1368.
Thank you for your testimony. Next, please.
Good morning. My name is Kelly Bradford. I am 44 years old and I have had 5 abortions. Unfortunately, when I was growing up, I was misled and told that Planned Parenthood was the only place for me to go to receive my care for my pregnancy other than the hospital. When I went to Planned Parenthood, they did not speak with me about continuing my pregnancy or provide prenatal care, support, or resources. Not one time did they sit down with me and educate me on my options other than abortion. Not once did they show me what an abortion actually is and what the different stages of abortion look like depending on how far along I was, because if they did, I know I would have made some different decisions. When I learned about Alternatives Pregnancy Center and others like it, I was blown away by the quality of care they're providing and the time they take to sit down with each patient to go over their options when faced with an unplanned pregnancy. But I was also baffled because I didn't know pregnancy centers existed when I was faced with an unplanned one and needed help. Through my experience with Alternatives Pregnancy Center, I've personally been able to meet women who also chose to abort and are still battling with that decision many years later and have asked the same question as me. Where were the pregnancy centers when we needed them? But because of Alternatives, I have received free prenatal care when I was faced with an unplanned pregnancy and healing through their abortion recovery classes. SB 1368 is such an important bill that means more than many of you up here today will ever know. Women deserve to know all of their options, and pregnancy care centers provide vital information that we need to make the best decision for ourselves and our unborn child. Whether it's to be a parent, to choose adoption, or abortion, it's only fair and just that we give our students all options. So, Senators, please do what is right and make these resources available to our youth. Thank you.
Thank you, Ms. Bradford. Any other witnesses in support of this measure, please come forward, state your name, your organization, and your position.
Samara Palco with the California Catholic Conference, in full support.
Thank you.
Jeanette Chen, President of California Alliance of Pregnancy Care, and I'm in full support.
Thank you.
Mike Murray, representing the American Council, in support.
Thank you.
Sophia Laurie with California Family Council, in full support.
Thank you.
Deacon John Wilson, Los Angeles, in support of women who are going through difficulties. I think they need to have choices.
Just your position. Thank you.
My name is Matt Newton. I'm a pastor here in Sacramento, as well as have a daughter, and am in full support.
Thank you.
Hello, my name is Caroline Laurie. I'm a parent of 4, 2 in public school, and a retired LA Unified School District teacher.
Thank you.
My name is Misty Jones, and I am a mother. I'm a mother of 4. I was also a teen mother, and I am not in support of this bill.
You're not in support of this bill. All right. We'll get to opposition when we. Oh, she's gone. So let's move on to opposition. Are there any lead witnesses in opposition to the measure? Seeing none, are there any in the room who would like to express opposition to the measure? We had one. Let's come back to the dais. I'll start. So, Senator Cho Bug, appreciate what you're trying to do. You've made at different times an emphasis on the word licensed pregnancy centers. My understanding is the bill refers only to pregnancy centers generally. So,
Licensed. We have an amendment to that said should be licensed.
And is that amendment? Is the committee aware that? All right, the committee's not aware of that amendment.
I'm pretty sure we have the amendments to ensure that it was licensed.
So my understanding is the deadline for amendments passed prior to your submitting that language.
Well, the intent, and I promise you, is it was submitted. It might have been late. But the intent is to only include licensed pregnancy centers. That was the intent from the very get-go. How it did get messed up on the original language, I don't know how that happened. But when I was made aware of it and I read that, we did ensure that we had an amendment in saying that it was amended. So,
okay. I think that's
if it
fair.
passes the committee, you folks are able to amend it moving forward.
All right. Okay. That's fair. And so I guess I'll give you a chance to close. My understanding is I can't move it. Senator Cortese is not inclined to. We'll have to wait for another member to come back to make the motion. So go ahead and close.
Absolutely. Well, I want to see your excitement there, Chairman Newman, on this bill. So most importantly, I want to make sure that we are in absolute agreement that these only cater to licensed medical pregnancy centers. One of the beauties about being able to serve in this capacity as a senator is the availability to information, the ability to talk to many stakeholders throughout the state in different spaces. And I have to be honest, I did not actually know about pregnancy centers until I was actually brought forth with the idea of carrying this particular bill. And it compelled me to actually attend and visit one of my local pregnancy center. And I was so impressed with the work that I was exposed to. From the fact that it was a warm environment, a caring environment, non-judgmental, and more importantly, that there's this. I know your question was we already have facilities that with Planned Parenthood that offer services.
That was not my question.
Oh, sorry. It was my understanding that we already have these services available. But what we don't have is the fact that we have licensed pregnancy centers that actually provide services throughout the pregnancy and after the birth of those babies, with all of the facts and the data that I presented today. We are a legislature full of data. We like to have data that backs much of our legislation, which is why we've included everything that they, all of the services that they actually provide. It is another additional resource that we don't currently have access to. And in the understanding of DEI, diverse options, equity, as mentioned earlier by Kelly Bradford, and thank you for sharing your being so vulnerable today and sharing your personal experience. It is very powerful. And inclusion, including different perspectives and approaches to making decisions about pregnancy or abortion, for that matter, for choice. But what this bill provides, we don't have currently in place. And I believe as legislators, as we learn about the resources that are available to our community and to the young women and older women, whoever might have an unplanned pregnancy, to make sure and ensure that our systems actually provide the ability to have access to these resources and awareness of it. And with that, I will close with Senate Bill 1368, would provide additional resource for middle and high school students alongside the resources they already provide. Given that licensed pregnancy center management and staff offer extensive information and confidential services to young people who are facing difficult pregnancy decisions at no cost, this should be a resource offered to students under the state's curriculum. Students receive state-mandated education deserve to know all available options so they can make fully informed decisions about all the issues surrounding their sexual health. This is a companion to what we currently have in systems with Planned Parenthood, a collaborator in ensuring that our young women have all options and resources available. So with that, I respectfully ask for an aye vote.
Thank you. We will leave that matter on hold until such time as we have additional members present. Thank you to the witnesses for being here. And thank you for the discussion. And we have...
Do you want me to...
No, actually, Senator Grove is she's been waiting, so if you don't mind. And she is in the hall. And Chair Senator Grove.